What most people never realize is that the moment you cross the threshold of your 60S, the proteins residing within the lens of your eye begin accumulating damage at a pace your body simply cannot reverse. And the reason for that is something I find remarkable every time I explain it. Those proteins were manufactured once, before you even took your first breath, while you were still developing in the womb. And from that moment forward, your body never produced them again, meaning they are tasked with serving you for the entirety of your life, absorbing punishment year after year, decade after decade, slowly warping, fusing together, and transforming what was once a crystal-clear optical surface into something turbid and light-scattering. And that transformation is precisely what explains the blurred vision you wake up to, the luminous rings that bloom around oncoming headlights when you drive after dark, the persistent filmy sensation that no amount of blinking ever fully resolves. And by the time most individuals find themselves seated across from me hearing phrases like age-related changes and progressive deterioration, that protein damage has typically been accumulating silently for 2, sometimes 3 full decades without a single warning signal. Today, I want to walk you through 6 seeds, all of them available at your local grocery store right now, each one containing specific bioactive compounds that directly nourish the very protective system your lens proteins have been starved of. And I have ranked them from the least impactful at the bottom, all the way up to the single one that outperformed every other option across every metric I examined. And I must flag something about the third seed on this list before we go any further, because the way the overwhelming majority of people currently consume it means their bodies are extracting almost nothing useful from it whatsoever. But before we get into the seeds themselves, I need you to understand the internal architecture of what is happening inside your eyes, because once that mechanism is clear, the logic behind why these seeds work becomes self-evident, and the reason your previous efforts may have fallen short will make complete sense here, is the anatomical reality that almost no one outside of ophthalmology ever hears. Your eye lens receives no blood supply, not a reduced blood supply, not a compromised one, none at all. It is entirely isolated from your circulatory system, which means no oxygen delivery, no repair machinery, no replacement components. Nothing. It operates exclusively on its own internal biochemistry from the day you were born until the day you die, and the molecule that powers that biochemistry is called glutathione, a compound present in extraordinarily high concentrations in a youthful lens, and as long as glutathione remains abundant, the lens proteins stay structurally intact, spatially separated, and optically transparent, allowing light to pass through cleanly and land precisely where it needs to on your retina. But here is what the published research has confirmed, and what almost no mainstream conversation acknowledges. Sometime in your 50s, a physical diffusion barrier begins forming around the nucleus, the innermost core of your lens, and that barrier progressively chokes off the glutathione supply to the exact location where the most visually destructive cataracts originate, meaning your lens core begins losing its primary antioxidant defense while you are still entirely asymptomatic, still reading comfortably, still driving without hesitation. And once that glutathione shield is compromised, the lens proteins begin to unfold, aggregate, and scatter incoming light rather than converging it. And when I look at a patient's scan showing those early changes, I can tell them honestly that yes, this is an aging process. But what I also tell them, and what I believe every person deserves to hear, is that this process, the glutathione depletion, the protein clumping, the oxidative cascade spreading through the lens tissue, is meaningfully influenced by dietary intake, by specific antioxidants, by specific fatty acids, by compounds found inside 6 seeds that most people walk right past in the grocery store without a second thought. Cataract surgery is the single most frequently performed surgical procedure on the planet, and researchers have calculated that delaying the onset of clinically significant cataracts by just 10 years could reduce its overall incidence by half. And yet the nutritional compounds that support the biology capable of making that delay possible receive almost no public attention whatsoever. And that absence of information is something I want to correct right now. Seed number 6 is sesame seeds, and before you move on, there is one critical thing about them that almost nobody mentions, and that omission is actively costing people a significant portion of their nutritional benefit. Sesame seeds contain zinc, a mineral your retina depends on to activate the enzymatic defenses protecting your photoreceptors and to shuttle vitamin A from liver storage into your eye tissue where it is needed. They contain copper, they contain vitamin E, genuinely valuable eye-supporting micronutrients. But here is the problem. Sesame seeds are densely packed with phytic acid, a compound whose primary function inside your digestive tract is to chelate minerals. It physically binds to zinc, copper, and every other beneficial mineral in those seeds before your intestinal wall has any opportunity to absorb them. And the entire complex passes straight through your system, meaning you chewed it, you swallowed it, you felt virtuous about it, and a meaningful fraction of those minerals never entered your bloodstream. The fix requires 3 minutes and costs you nothing. Dry roast them in a pan over medium heat for approximately 3 minutes until that warm, nutty fragrance rises and tells you the heat has done its work, because that thermal exposure breaks down the phytic acid and liberates the minerals bound within. And now your body can absorb what you actually paid for a small handful of toasted sesame seeds over a salad or scrambled eggs, roughly $2 per month. But I want to be direct with you. Sesame seeds represent a floor. They can slow your rate of loss. They are not reversing anything. And the seeds higher on this list operate in an entirely different biological tier score. 3 out of 10 seed. Number 5 is pumpkin seeds. And this is the entry that tends to genuinely upset people who have been eating them diligently for years, because pumpkin seeds contain 2 compounds that Harvard researchers confirm deposit themselves in one extraordinarily specific location inside your eye. Not the whole eye, one specific structure, the macula, the dense central zone of your retina responsible for reading, recognizing faces, driving, anything you look at with direct intention. The region that deteriorates first and fastest those 2 compounds are lutein and zeaxanthin, and decades of large-scale longitudinal research have linked higher dietary intake of these carotenoids to significantly reduced risk of macular degeneration progression. And the reason is architectural. Your macula is literally yellow because it concentrates lutein and zeaxanthin. On purpose, your visual system is biologically engineered to collect and stockpile these compounds. And pumpkin seeds also deliver more zinc per ounce than virtually any other seed commercially available. And here is what should frustrate you. If you have been eating pumpkin seeds out of a bag, roasted, raw, salted, any preparation at all, you have been absorbing perhaps half of what they actually contain, because pumpkin seeds carry an even higher phytic acid load than sesame seeds. And until you chemically neutralize that coating, the lutein, the zeaxanthin, the zinc are bound and bypassed. The preparation is almost offensively simple. The evening before, place your pumpkin seeds in a bowl of water, squeeze half a lemon into it, stir once, and leave it for 8 hours, because the citric acid chemically dismantles the phytic acid barrier overnight, and in the morning, you drain them, rinse them, and eat them as they are, or dry them briefly in a low oven score. 4.5 out of 10 seed number 4 is one I find genuinely frustrating in terms of how little attention it receives, and that is hemp seeds, because while the nutrition community perpetually debates flaxseed versus chia, hemp seeds are sitting right there on the shelf, accomplishing something no other seed on this list can achieve independently. Your retina is neural tissue, structurally and functionally identical in its cellular vulnerabilities to your brain tissue, and those cells are acutely sensitive to chronic low-grade inflammation, and when inflammatory activity reaches your retinal layers, cell membranes weaken, signal transmission slows, and visual degradation begins in ways that do not appear on a standard eye chart until the structural damage is already established. The single most consequential nutritional variable in managing that inflammation is the ratio between omega-6 and omega-3 fatty acids in your diet, and contemporary Western diets push that ratio somewhere between 15 and 20 to 1 in favor of omega-6. While the research suggests the human body functions optimally near a ratio of 3 or 4 to 1, that chronic imbalance sustains a low-level inflammatory environment throughout your entire body, including your ocular tissue. Every single day, hemp seeds carry a naturally occurring omega-6 to omega-3 ratio of approximately 3 to 1, and no other widely available seed comes anywhere close to that physiological target. A large meta-analysis synthesizing 19 randomized controlled trials involving more than 4,000 participants confirmed that correcting this fatty acid imbalance produces measurable reductions in the inflammatory biomarkers, driving dry eye disease, the chronic burning, the progressive dryness, the gritty foreign body sensation that intensifies as the afternoon wears on score. 7.5 out of 10, seed number 3, is the one I flagged at the very start, and that is chia seeds. Specifically, the mechanism by which almost everyone currently consuming them is obtaining nearly nothing of value. Let me give you the biology first. Your retina is not partially constructed from DHA. It is structurally built from it. DHA constitutes a major architectural component of the tissue your vision physically depends on, and when DHA is chronically undersupplied, that tissue begins to degrade, cell membranes thin. The structural integrity of your retinal layers erodes quietly across years. Chia seeds are among the most concentrated plant-based sources of ALA, the botanical precursor omega-3 that your body enzymatically converts into DHA, and a large meta-analysis of 19 randomized trials confirmed that omega-3 intake produces measurable improvements in tear film breakup time, which is the clinical measurement of how rapidly your ocular surface dries out between blinks. And when that number is low, every blink feels incomplete. That is the burning. That is the grittiness. That is the persistent sensation of something lodged in your eye that never fully resolves. And here is where the waste occurs for millions of people. If you consume chia seeds whole, sprinkled into smoothies, stirred into oatmeal, soaked into a gel, the outer shell of the seed actively resists your digestive enzymes, and those seeds pass through your gastrointestinal tract, largely structurally intact, and you absorb a fraction of what you consumed. You are eating the packaging, not the contents. You must grind them, 10 seconds in a coffee grinder, and it must be fresh, not from a pre-ground commercial bag, because the moment a chia seed is cracked open and its interior is exposed to oxygen, those omega-3 fatty acids begin oxidizing immediately, and a pre-ground bag that has been sitting in warehouse storage, and then on a retail shelf, may have lost the majority of its biological potency before you ever opened it. Grind them yourself that morning, immediately before consumption, and always pair them with a fat source in the same meal, because DHA is fat-soluble, and without dietary fat present simultaneously, intestinal absorption drops significantly. A tablespoon of coconut oil blended into a smoothie, a drizzle of olive oil, half a ripe avocado, any quality fat, same meal, same moment, freshly ground with fat immediately within 1 to 2 weeks. Most people report that the morning dryness is noticeably less severe. The day no longer grinds against their eyes by mid-afternoon, and while the structural retinal benefit requires 60 to 90 days to accumulate meaningfully, the surface relief can arrive within the first week. Score 8 out of 10. Seed number 2 surprised me more than any other when I went systematically through the research, and that is freshly ground flaxseed paired with avocado. Flaxseed contains more alpha-linolenic acid per gram than any other plant source that exists, more than chia, more than hemp, more than anything else on this list. And 1 tablespoon of freshly ground flax delivers approximately 2,300 milligrams of plant omega-3, while chia delivers roughly 1,700 milligrams for the same volume. And every single day, that difference compounds biologically. The Women's Health Study, one of the largest and longest nutritional investigations ever conducted, following nearly 40,000 women over years, found that higher dietary omega-3 intake was significantly associated with reduced risk of dry eye syndrome, and flaxseed represents the most concentrated dietary pathway to achieving that intake. The avocado in this pairing is not a garnish. Omega-3 fatty acids are fat-soluble, and the monounsaturated oleic acid in avocado has been specifically identified in nutritional bioavailability research as one of the most effective fat carriers for enhancing the intestinal absorption of fat-soluble compounds. That avocado is not accompanying the flaxseed, it is activating it. Two rules, both absolute. Rule 1, grind it fresh that morning, not the night before, not from a pre-ground commercial product. Whole flax seeds in a coffee grinder for 10 seconds immediately before eating. Rule 2, consume it within 15 minutes of grinding. The oxidation clock starts immediately. 2 tablespoons on half a ripe avocado every morning. The only reason this sits at number 2 rather than number 1 is that the top seed accomplishes something flaxseed biochemically cannot. It delivers an antioxidant that your body actively regenerates inside your lens tissue for hours following a single serving score, 9 out of 10, and the number 1 seed, the one that led every single category I examined, is raw, unsalted sunflower seeds, consumed together with a quarter of a ripe avocado and fresh lemon juice squeezed directly over the combination. All 3 elements together. Every morning sunflower seeds carry more vitamin E per ounce than nearly any food you can purchase in a standard grocery store. And 1 ounce, a modest handful, delivers close to half your daily recommended intake of alpha-tocopherol, the specific isoform of vitamin E that your body preferentially absorbs and deploys, and vitamin E is not performing generalized antioxidant work in your eye. It is targeted with a precision I want you to fully appreciate. It positions itself within the membranes of your lens fiber cells, the precise cells housing the proteins that were synthesized before your birth and can never under any circumstances be replaced. And from that position inside the membrane, it intercepts oxidative damage before it reaches those proteins, a meta-analysis published in Public Health Nutrition, pooling data across multiple cohort studies and clinical trials, found that dietary vitamin E intake was significantly associated with reduced risk of age-related cataracts, with the protective effect being strongest specifically in the lens nucleus, the deepest core where oxidative damage accumulates over the longest timeframes. Now, the avocado, vitamin E is fat-soluble, and without dietary fat present at the time of consumption, a substantial portion passes through your system before absorption is possible, and the monounsaturated oleic acid in avocado is the optimal delivery vehicle for precisely this compound. But the lemon is the element that elevates this combination above everything else on this list. And I want the mechanism to be fully transparent. When a vitamin E molecule neutralizes a free radical inside your lens tissue, which is its entire biological function, it becomes oxidized in the process, spent, inactivated. Normally finished vitamin C interrupts that terminal outcome entirely. Research examining the biochemical interaction between vitamin C and vitamin E has confirmed that vitamin C takes that oxidized, spent vitamin E molecule and chemically reduces it back to its active, functional state. It regenerates it, so your single morning serving of vitamin E continues working inside your lens tissue for hours rather than minutes. One dose cycling and recycling itself continuously. And you are not simply delivering an antioxidant, you are constructing a self-sustaining protective system. That is why this combination sits unambiguously above everything else I have reviewed. And it costs less than 85 cents per serving. Your precise protocol. 1 ounce of raw, unsalted, shelled sunflower seeds, a quarter of a ripe avocado, the juice of half a fresh lemon squeezed directly over everything, all 3 consumed together, same meal, same time, every single morning. And the ingredient label on your sunflower seeds should contain exactly 1 item. If there is anything else listed, return it to the shelf. Here is what sustained daily use actually produces across time. In the first 3 days, the heavy, gritty, fatigued feeling your eyes carry into the evening, the sensation you have likely begun accepting as simply what eyes feel like after a long day begins to ease measurably by the end of the first week. Morning blur softens and the fogginess upon waking clears more quickly by the 2 to 3 week mark. Reading fine print, navigating phone screens, scanning menus in dim restaurants all require less effort and less squinting by 90 days. The halos around nighttime headlights begin calming, contrast sensitivity improves, and colors carry a vibrancy that has been absent for years. And some patients return from their follow-up appointments and tell me that Dr. Robert noted their numbers did not progress. The way the trajectory had suggested 90 days is the structural window. Dry eye relief arrives faster, sometimes within the first week, but the deeper lens-level work requires time. One caution I must be explicit about. Sunflower seeds carry a relatively significant omega-6 load, and the dose is 1 ounce per day. That is the therapeutic quantity, not 2 ounces, not a full cup, 1 ounce, because more is not better, and in this case, more actively works against you score. 10 out of 10 here is your complete daily protocol. Every single morning, without exception, your foundation layer, 1 ounce raw unsalted sunflower seeds, quarter avocado, half a lemon squeezed over everything. Together, non-negotiable, same morning. Your omega, 3-layer 2 tablespoons of hemp seeds on yogurt or blended into a smoothie, or 2 tablespoons of freshly ground chia seeds with a fat source present hemp if you want 0 preparation, ground chia. If you want greater omega-3 concentration, choose 1, and be consistent 3 to 4 mornings per week. Your deep structural layer, 2 tablespoons of freshly ground flaxseed. On the remaining half of that avocado, ground fresh, consumed within 15 minutes once weekly. Your macular maintenance layer, pumpkin seeds soaked the night before in water and lemon juice, drained in the morning, a small handful over yogurt or a salad. 3 mistakes that systematically undo all of this work. Mistake 1, coffee or tea within 90 minutes of consuming your seeds, because tannins bind zinc and other minerals and physically block the absorption of what you just carefully prepared coffee after, always after. Mistake 2, eating these in the evening rather than the morning, because fat-soluble compound absorption is measurably superior in the morning metabolic window. Mistake 3, discontinuing after 2 weeks because the transformation has not been dramatic, because dry eye symptoms respond within days to weeks, while structural lens protection is a 60 to 90-day biological process, and the research on vitamin E and cataract risk was measured across 18 months of consistent intake. Stopping at 2 weeks is the equivalent of planting a tree, returning 3 days later, and concluding that trees do not grow, do not discontinue any prescribed medications without first consulting with Dr. Robert or your own physician, because these seeds support your underlying biology. They are not a replacement for your medical care. Here is what I want you to do before you close this video. Write down the 3 vision complaints that bother you most right now, the specific ones. Rate each from 0 to 10. Put that paper somewhere you will find it in 30 days, and tomorrow morning begin with the sunflower seeds, the avocado, and the lemon, just that to start. 1 ounce, a quarter avocado, half a lemon, every morning. And if you want to move through this process alongside other people, drop day 1 in the comments right now, 2 words, and come back in 30 days to tell me what has changed. Your vision did not deteriorate in a week, and it will not rebuild in a week. But the proteins inside your lens are waiting for the raw materials that have the documented capacity to slow this process down. The grocery store carries everything on this list. It costs less than $1 per day, and there is no reason to wait until tomorrow morning.